Deputy Murphy, the floor is yours.
Thank you, Count Corla, and thanks for allowing me the opportunity to raise the issue with the Minister. Dentistry and orthodontics obviously play important roles in keeping people healthy. People who have problems with their teeth and gums can lead to other associated physical problems, but they can also lead to psychological and esteem issues, particularly for our young people. From a physical health point of view, we know the importance of looking after our teeth. We must also remember the cosmetic reasons why people want to have a good-looking smile. It helps with self-esteem, it helps people feel more confident in themselves, and naturally, that means they're happier. My topical issue refers to the orthodontic care system. The HSE say that, and I quote, "A patient may be referred by a primary care clinician for initial orthodontic assessment. In general, this referral takes place around the ages of 11 to 13 years of age, but can be provided any time up to 16 years of age." Now, based on that, Count Corla, it would be safe to assume that 11 to 13 years and up to the age of 16 are in general the best times for these assessments and interventions to begin. But no such assumptions should be made. The reason, let me give you some examples of the correspondence I'm receiving on the topic, and I'm quoting my constituents' parents, whose details I have emailed also to the Minister's office. One parent: "Today I received the very good news that my daughter, aged 15, qualifies for free dental braces, as her teeth are deemed bad enough to qualify for free dental assistance. She has already waited 3 extra years from her 6th class appointment with an orthodontist. Brackets, it usually takes place at the age of 12. So you can imagine how horrified we were to be told that it will be an extra 6 years before we hear about her next appointment in County Wexford. She's now 15 and will have to wait until she is 21 years old to have braces fitted. She is distraught, and so are we as her parents." Another parent: "My child was assessed by a HSE orthodontist in Enniscorthy on the 8th of June 2018. I was informed that he would definitely qualify for dental treatment through the HSE as he is an extreme case. I was told there was a 4-year waiting list. I was extremely shocked by this, but reassured by the orthodontist as she explained this would be the optimal time for my child. I rang the orthodontist department during the first lockdown, but the phone wasn't answered and no one responded to my voicemail. I finally managed to get through to them last week. I was extremely horrified and upset and frustrated when I was told by the secretary that Robbie has a further 3 years to wait. That's the waiting list that has now gone from 4 years to 6 years. Minister, this is the reality for so many parents and patients. Now, I wrote to your department a couple of weeks ago, and I'll quote directly from the response I received. The waiting list is now approximately 72 months duration. Due to the COVID-19 pandemic and the additional measures in place, the orthodontic department have reduced capacity and have not been able to take any new patients off the treatment waiting list since March 2020. With all of the information in mind, Minister, and given how important the scheme is, will you outline when the system will resume taking new patients from the treatment waiting list, which has now been suspended since March 2020, and what steps are being taken to reduce and speed up waiting list times? A 6-year waiting list clearly means that there are major problems in the system and something has to be done urgently. Now, that also comes on the back of Wexford General Hospital having an increase of 69%, accumulating now to almost 5,300 patients on a waiting list. We have no psychologist in CAMS for nearly 3 years, no dietitian in CAMS for 3 years, and no podiatrist now at Wexford General Hospital. Thank you.
Thank you, Minister Feehan, for being here to deal with this matter.
Thank you, and I want to thank Deputy Murphy for the opportunity to address the issue of waiting lists for orthodontic services on behalf of Minister Donnelly. The HSE, as you know, provides orthodontic treatment to those who have the greatest level of need and have been assessed and referred for treatment before their 16th birthday. An orthodontic assessment determines if the referral meets the criteria for the service, and if so, what priority the patient is given. Those with the greatest clinical need are prioritised. Orthodontic services are generally provided by orthodontic consultants and specialist orthodontists, who are based in the HSE orthodontic clinics throughout the country. and in addition, orthodontic therapists assist in providing services in some areas. The Minister, I accept there are significant delays in accessing some services provided by the HSE, caused in part by the necessary concentration of resources at managing the current COVID-19 pandemic. I also acknowledge that prior to the pandemic there were already ongoing difficulties which led to lengthy waiting periods in accessing orthodontic services. Waiting lists vary regionally and according to the complexity of the condition. There are generally longer waiting lists for the least complex care. At the end of 2019, over 10,000 children were awaiting assessment, while 19,000 were awaiting treatment. However, a further 17,000 children were in active treatment. I do not have total waiting figures for 2020 because the staff involved have been redeployed. However, I am aware that service has experienced 12 months of continual disruption because of the pandemic. The Minister is informed by the HSE that during 2020, over 9,200 orthodontic patients were seen for assessment and 1,466 patients commenced active treatment. Elective orthodontic services have gradually resumed. Social distancing measures and other organisational measures, as well as infection prevention and control guidance, mean that their usual throughput of patients is currently reduced, but this is expected to improve over time. Difficulties in recruiting consultant and specialist orthodontists in some parts of the country has added to this problem. The HSE is putting in place a number of measures to address waiting times, and these include the filling of permanent vacancies is being prioritised, with recruitment to fill 2 consultant posts ongoing at present, and a treatment waiting list initiative between 2016 and 2020 resulted in 1,996 patients being placed in treatment with service providers at a cost of €5.8 million. A new initiative to outsource treatment for patients with less complex orthodontic needs who have been waiting over 4 years is now at invitation to tender stage, and this will provide treatment for approximately 300 patients annually at a cost of €1 million. It is anticipated the first group of patients will be allocated to service providers in the second half of 2021. The HSE is developing a standard approach to assessment with consultant and specialist orthodontists and annual training for referring dentists, and the purpose of this is to ensure that all referrals will receive an orthodontic assessment within 6 months and that the number of appropriate referrals will be reduced. Also, access to orthodontic treatment in EU jurisdictions is available under the EU Cross-Border Healthcare Directive for patients and already on an orthodontic treatment waiting list. And many patients in border areas have accessed care in Northern Ireland through this route pre-Brexit, and 342 patients accessed cross-border care in 2020, and this is being continued through the Northern Ireland Planned Healthcare Scheme. I want to reiterate that Minister Donnelly and I fully acknowledge the waiting list for essential orthodontic treatment are unacceptable, and we want to see real improvement this year with significant funding that the Government has made available for enhanced community care.
Thank you, Minister Feehan. Deputy Murphy.
Count Corla, I have to say I'm very disappointed that somebody at the level of this House would come in and reiterate everything that you can read from a website. These parents want to know when their children are going to receive their treatment. Now, the Minister perfectly well knows that waiting lists have not gone down in years, and therefore I don't know where the expectation comes from that they will definitely come down, because the reality is here's a PQ received to Minister Donnelly, the now Minister, when he was a TD in 2019. And at that stage, the waiting list in Wexford was 10,586. Now, I can't imagine, Minister, what that has gone to at this stage, because, like you, I'm unable to get the current figures either. But with due respect to the people of Wexford, whose waiting lists in every arena to do with health are just growing. And I'm sick of telling people there is a cross-border initiative. These are children. Orthodontics is a very specialised area that nobody wants to be at, having to travel 4 to 5 hours to have treatment, much less it is not the same process. You must pay for the treatment and then be rebated. It's not simple and it doesn't work. And it certainly doesn't serve to reduce our waiting lists. I'm very disappointed that with notification of the question I've asked, here's a 21-page answer from the HSE in 2019 that you have literally read the first 3 paragraphs onto the floor of the Dáil, Minister. That's not an answer. The people require an answer. They require the waiting list to come down, and the orthodontic services should be in place. The pain and anguish of the children involved are increasing their anxiety levels to add to their orthodontic problems, and that's causing gross mental health issues. And I'm really asking you to address it in a fair-minded manner. And it's not just that we don't have an orthodontist. We don't have our fair share. We have the highest waiting list in the country. Thank you, Count Corley.
Thank you, Deputy. Minister, to conclude, please.
Yeah, look, I'm aware also with the Deputy of the difficulties experienced by young people, and especially in Wexford, as you articulated, who are waiting for the orthodontic treatment for long periods. And as I outlined to the House, the Department and the HSE will be undertaking a number of initiatives to address the issue of waiting lists for orthodontic care. You know, there is work going on with Sláinte Care in conjunction with the HSE and the National Treatment Purchase Fund, and community waiting lists will be included in that plan. And the Government is committed in the coming years to the transformation of oral healthcare services in accordance with the guiding principles of set out in Smile agus Sláinte, the National Oral Health Policy, which was published in 2019. Also, you know, regarding orthodontic services, the policy supports the delivery of some orthodontic procedures in primary care dental practices, supported by clinical care pathways. But I do acknowledge that there are issues, and I'd just like to thank you for raising these. I will bring them back to the Minister, and if we can, we might be able to get you further figures. There are issues, and there's a groundwork to transform oral health services. And again, Sláinte Care, as you were involved in, hopefully that we can try to work within that agenda to deliver the needs of the people at the core and the provision of services at a local community paramount. But you know, there are issues with the cross-border initiative regarding people paying up front and all that, and I will talk to the Minister and see is there any way we can get that resolved. Thank you.